An analysis in nearly 2.3 million Europeans has found detrimental associations between cold weather and deaths from heart disease, particularly in poor neighborhoods. Study author Professor Stefan Agewall of the University of Oslo, Norway said, "Climate change is leading to a rise in the average global temperature but also extreme cold in some regions." The EXHAUSTION project used individual data, enabling us to identify vulnerable subgroups for protective interventions, thereby increasing resilience for future weather events. The analysis included 28 million adults from 5 cohort studies conducted in Italy, Germany, the UK, Norway, and Sweden. The average age ranged from 49.7 years to 71.7 years, and the proportion of women ranged from 36.0% to 54.5%. Participants with and without cardiovascular disease at baseline were included. Data on mortality and new-onset disease were collected through death and disease registries and follow-up surveys. Monday. With the temperature on the same day of the week without an adverse event, e.g., all remaining Mondays, within the same month. With an approximately 10 degrees Celsius temperature drop, from 5 degrees Celsius to -5 degrees Celsius, there was a 19% greater risk of death from cardiovascular disease. Relative risk, RR1. 19. 95% confidence interval, C1. 0.4.1. 36, and a 22% elevated likelihood of death from ischemic heart disease, RR1. 22. 95% C1. 0.7.1. 38. There was a 4% higher risk of new-onset ischemic heart disease associated with an approximately 11 degrees Celsius temperature drop, from 2 degrees Celsius to -9 degrees Celsius, RR1. 0.4. 95% C1. 0.1.1. 0.8. The links between cold and new-onset ischemic heart disease were stronger among women and people older than 65 years. Heat was not related to detrimental effects in the overall study population. However, temperature rises from 15 degrees Celsius to 24 degrees Celsius were associated with 25%, RR1. 25. 95% C1. 12:1. 39, and 30%, RR1. 30. 95% C1. 10:1. 53. Elevated risks of death from cardiovascular disease and stroke, respectively, in people with heart disease at baseline. Patients with heart conditions should stay hydrated in hot weather and adhere to advice from their cardiologist on medication use. We can all check the news for extreme heat and cold alerts and follow safety tips from local authorities. References and notes. 1 EXHAUSTION will be presented by Dr. Siki Zhang from Helmholtz Munich during the session Latest Science in Primary and Secondary Prevention and Environmental Health on Fri. European Society of Cardiology. 2022, August 26. Potential threat to heart health from extreme weather. Science Daily. Retrieved August 26, 2022 from ift.tt/GHWCW3L European Society of Cardiology. Potential threat to heart health from extreme weather. Science Daily. ift.tt/GHWCW3L. Accessed August 26, 2022. Thanks for watching. Please subscribe my channel for more videos.